Illness. In this video, we will be discussing about every aspect of illness, which includes definition, types, stages, and impact of illness in the family and society. What is illness? Illness is a condition which is deviation from a normal health state. So, as per Potter and Perry, illness is defined as a state in which a person's physical, intellectual, emotional, social, and spiritual functioning is diminished or impaired in comparison with the previous experience. What are all the types of illness? Illness is divided as acute and chronic illness. Acute illness is always a sudden and emergency situation, whereas chronic is a slowly progressive illness which can be treated commonly. There are a lot of variables which affects the illness behavior, which includes internal and external variables. So the internal variables are perception of the symptoms. So it depends upon the person's perception of the symptoms, the illness behavior changes. The nature of illness. So it depends upon what kind of health problems you have. It depends upon that the illness behavior happens. It depends upon the characteristic of person. One person may have a high tolerance to pain, whereas the other one will have a poor tolerance to pain. So it depends upon the characteristic of a person, the illness behavior is happening. So there are a lot of external variables affects the illness behavior, which includes visibility of symptoms. Sometimes you may have a lot of health problems, but visibly you may look healthy. So of course that plays a very important role in illness behavior. Social group. For example, if you are in an official group in front of your superior, you won't show your illness behavior much. Whereas if you are in a friends group or a family group, of course your illness behavior changes. So it depends upon what kind of social group you are in, depends upon that the illness behavior changes. Culture and values. So there are culture where they are not supposed to show the pain and illness behavior in the public. So that kind of culture and values, if anybody is having, so they may not show illness behavior outside. Economic variable. So you can see that poor people who have a lot of physical strain, they may not show their illness behavior comparing to a very soft rich person. Accessibility to healthcare system. So sometimes what we do, if you are not nearby a health facility, you may subside your illness behavior. So these are all the variables which affects your illness behavior. So there are internal and external. Stages of illness. The stages of include 5 stages. It's not necessary that everyone should go through all these 5 stages. Some may skip some stages as per their uh, it depends upon their health condition and the characteristics. So the first stage is symptom experience. In this first stage, what happens, the person will start to feel some problem in their health. So they may have some early signs and symptoms like pain, rashes, or sneezing, coughing, those kind of some symptom they may experience, which indicates that they are having a deviation from a health. So at this stage he is able to make decision that it is a symptom of an illness. So what happens in the second stage is assumption of sick role. So once the illness symptoms are continuing, he will start showing or playing a sick role in front of the family or with the others. So they may get away from their normal duties. They may apply for a sick leave. They may start asking excuses. So assumption of sick role includes results in emotional changes such as withdrawal, depression, physical changes. Some people may deny or delay the contact with the healthcare system. So sometimes when you play a sick role in your family, your mother may start giving some home remedies, or starting of home remedies happens in the assumption of sick role. If that home remedies are not curing your illness, they may move on to stage 3, which is called medical care contact. So if the home remedies are not curing your symptoms, what happens, you may move to stage 3, which is called medical care contact. Here what happens, you may go and ask a health professional for the treatment. So you may you may go and check with the doctor and start the treatment. So the next stage is dependent client care. So once you are under the medical care, what you have to do, you have to get admitted and start taking the treatment. So the client accepts the care, sympathy, protection from the demands and stress of life. So you will be completely give your health responsibilities to the professionals. So stage 5 is recovery and rehabilitation. What happens here, the symptoms will start subsiding and you become a healthy person and your health status improves. And chronic illnesses, they may go into prolonged reduction in health and functioning. So you may need to adjust with the lifestyle and medications. So the next one is emotional responses to illness. So what happens once you become sick? So most of the people will undergo this, but it depends upon the characteristics of a person, how long you will be experiencing this. So emotional response includes fear. The next one is over dependence or feeling of helplessness. You may either depend too much, like you can see some people like they want to lie in mother's lap, they want to go to their mother's house. Yes, then feeling of helplessness, like as like nobody is taking care of them. So these are all the emotional responses happens to illness. The next one is anxiety. And once all this fear and dependence and anxiety goes, you may have a hope once you get hospitalized or you see a doctor. So some people may show anger and hostility, especially when you are diagnosed with a chronic diseases like diabetes, hypertension, or cancer. These kind of diagnosis makes the person anger and hostility. So what is the impact of illness? When one person in a family is ill or sick, what happens? The impact may affect the client themselves, also in their family. It affects their body image, it affects their self concept and family dynamics. So you have to, when you talk to the client in front of you, you have to make sure that what is the role they are playing in a family. Okay, what is the feeling or emotional responses towards the illness of the patient. So all these things you should make sure before you talk to a person. So it may affect the client themselves and it may affect their family roles. If he is the main breadwinner of the family, that may affect the whole family. So you have to see who are all the family members who can support him in the family roles. Body image disturbance, some kind of illness may affect their body image. So you have to check how much impact the client may have towards a body image. Self concept, it depends upon the patient's acceptance. So a clear communication makes it very effective to reduce the impact on self concept. Impact on family dynamics. So the changes in the family happens when one person is playing a sick role. On the whole, we have seen in this video what is illness, what are the types of illness, variables affecting the illness behavior, stages of illness, emotional responses to illness, and impact of illness. So in this video, I just want to make sure that the stages of illness is a frequently asked question in second year medical nursing. Okay. Thank you. See you once again in next video.